Welcome to the Student Health Services presentation of Addressing Student Health Needs in the Classroom, Secondary Schools. We appreciate your attention to the safety and health needs of students under your supervision. At the completion of this presentation, the participant will be aware of the resources available to support student safety and health needs, have an understanding of the points to consider when sending a student to the health office, review and recognize the following emergencies: anaphylaxis, asthma, seizure, diabetes, and head injuries, identify non-emergency issues and the appropriate actions to be taken, and define a field trip and identify the information needed by the health office for planning and preparation. Our goal for all students is to keep them in the classroom to maximize learning. There are many resources available to support the health and safety of students as listed here. Please be aware that our on-site office is referred to as the Student Health Office. We do not use the term clinic, which implies a broader range of treatment, such as an urgent care clinic or other types of clinics. Registered nurses staff the health office in the secondary schools. Resource nurses provide registered nurse coverage at assigned schools within a geographic area. Please see the resource nurse listing, which is posted in the health office. We can be reached through Student Health Services at 571-252-1017. We encourage you to ask questions and communicate with the health office staff in order to clarify student information and plans. If you have any additional medical certifications or trainings such as CPR, first aid, medication administration, or diabetes management, please notify the health office staff at your school. Your name will be added to the medical training list, which will be compiled to produce a listing of all staff members within the school who can be used as resources when care is needed for a student. The AED, or Automated External Defibrillator, is located in high-volume public areas in the school. The box is unlocked but alarmed. When opened, it does not automatically notify anyone, such as 911. In other words, it's not connected to an alarm system or monitoring system. It is merely an audible noise to alert others that the AED box is being entered. AED is not used for a conscious person. Please know how to call for help from all locations in the building where you might be supervising students. AED teams are formed in all schools and practice drills are held annually. Some of you work in the community where you live. Please recognize that confidentiality is required through privacy acts. If a teacher enters the health office, please refrain from asking students who are waiting to be seen questions regarding their care, as this is a violation of privacy. Health office staff may not share info with a staff member unless it is a student that they send to the health office, and it's on a need-to-know basis. If you share information with us about a student, we will also respect privacy laws. If you are a case manager, please notify us of an upcoming IEP, as we may need to work with you to enter a medical statement and/or attend the meeting. The Health Conditions List is another resource available. Teaching staff can go to the Phoenix Class List Report tab, HLT 404, and can print out the Health Conditions List. This list is put together using the information provided by parents from the student profile. Treat what you see and don't ignore symptoms merely because they aren't listed as having a medical issue. It may not be listed because students can experience symptoms for the first time at school, or parents may have forgotten to share or neglected to share health information with us. Do share this information with substitutes. Do not share the information with volunteers. Think about these points before sending a student to the health office. Is it an emergency versus a non-emergency, or do they need to be sent at all? When to send to the health office depends on several issues, including the environment, staffing, and the student itself or their family. The student may need to remain where they are and have help come to them, for example, when anaphylaxis or potential injury of the head or neck are involved. Think, what can I do until help arrives? Remember to check care plans for symptoms of an emergency or an emergency action plan, EAP. Please don't hesitate to discuss any questions you may have about a student's emergency action plan or when to send a student to the health office. When sending a student to the health office, please use a pass for non-emergency situations. In order to maintain privacy, we will only complete the destination portion of the pass, such as going home, returning to class, etc. So let's start with some issues that require a timely response. Severe allergies may occur through exposure by ingestion or contact. Prevention is key, and we urge you to become familiar with the LCPS Procedural Handbook for supporting students with allergies. Do not feed students or approve foods. Only a parent can determine what is safe food for their student. We also don't use signage that states peanut-free or allergy-free. Rather, we use allergy awareness signage available from Student Health Services. Be aware of students' individual health care plans and how to support that student in the classroom and school. The most common allergens for severe allergies are peanuts, tree nuts, eggs, milk, fish, shellfish, soy, wheat, latex, insect stings, and medications. Please be aware this is not an inclusive list, and students may be allergic to other allergens not listed here. Be prepared and recognize these symptoms of anaphylaxis, which can include hives or swelling anywhere, difficulty breathing or shortness of breath, coughing, wheezing, or repetitive throat clearing, tingling or itchiness anywhere, difficulty swallowing or a tightness in their throat, nausea, vomiting, diarrhea, or stomach ache, changes in their voice or a hoarseness, sneezing and runny nose, pale or weak, burning mouth and throat, panic, anxiety, or a sense of impending doom, or loss of consciousness. An episode of anaphylaxis may include one or two of these or many of these symptoms. So what do you do for a student that may not have any symptoms, but may be uncertain or unsure if they were exposed to an allergen? Ask if the student has eaten anything other than approved foods. If in doubt, call the health office, identify the student, and give the student's location. If there was contact with the allergen, remove the allergen and wash the area with soap and water. Depending on the student's action plan, they may be able to come to the health office with a buddy or teacher if no symptoms, or they may need health office staff to come to the student and administer epinephrine. Read and follow the individual action plan. If you determine that a student is showing signs and symptoms of anaphylaxis and an epinephrine autoinjector needs to be given, remain calm. Allow the student a position of comfort, either sitting or lying down. If you're at school, immediately call for the health office staff or give the student's epinephrine autoinjector if the student carries their own as per doctor order. 911 will be called. If you're on a field trip, again, remain calm. Allow the student a position of comfort, either sitting or lying. Administer the epinephrine autoinjector. Call 911. Elevate their legs, and monitor them for returning symptoms. Be sure to contact the school, administrator, and the parent. If the student also carries an inhaler, administer the inhaler as well. There are several different types of epinephrine autoinjectors. Please watch the short video that follows describing EpiPen autoinjector use.
A life-threatening allergic reaction, anaphylaxis,
is unpredictable. It could be mild 1 minute, then suddenly...
It's scary, like you can't even breathe scary.
Or your skin gets all itchy and breaks out into hives scary.
or your throat starts to tickle and close scary. It's different for everybody.
Every reaction is different. A mild reaction one time can be life-threatening the next. So it's important to know your body and know when it starts to feel funny. It could be the warning signs of anaphylaxis.
So it's also important to know how to use one of these.
An EpiPen autoinjector.
EpiPen and EpiPen Junior are for the emergency treatment of life-threatening allergic reactions.
And for people who are at an increased risk for these reactions.
EpiPen and EpiPen Junior should only be used to help someone during an emergency.
Ready to show them how it's done?
Yeah,
EpiPen Junior, the one with the green label, is for kids.
like me.
An EpiPen with the yellow label for bigger people, like me.
Whether you need to use EpiPen on yourself or give it to someone else, you can just follow these simple steps. So first things first, you take it out of the tube,
Just flip open the yellow cap,
or the green cap.
slide it out, and hold it like this.
Blue to the sky.
Orange to the thigh.
Then you take off the blue cap.
Blue safety release.
Never put your hands near the orange tip because that's where the needle comes out.
The needle is designed to go through clothing, including jeans, because it must be injected into the outer thigh for quick absorption. If you're helping a young child,
Like me.
hold the leg firmly in place. Once it is,
You just do this.
Boom.
It clicks, so you know it worked. Then you hold it there for 3 seconds.
Then, remove EpiPen.
you'll still see some liquid in there, but don't worry, your EpiPen Junior auto-injector gave you the right dose, and it has a special feature, the Never See needle.
Yeah, so the needle's totally covered up.
So you should never see the needle.
Then rub the spot for 10 seconds while you or someone else gets emergency medical help right away.
AviQ is another type of epinephrine autoinjector. Like the EpiPen, AviQ can also go through clothing, also contains epinephrine, is administered in the same site for injection with the student in the same position, either sitting or lying down. It also has a retracting needle so it won't stick out after giving. You can see the steps here on the slide. Administration of the AviQ also requires you to call 911 and continue to monitor the student for potential of returning symptoms and a need for a second AviQ autoinjector. The AviQ prompts your actions with audible directions, as you can hear in the following video. The student is standing for demonstration purposes only and should also be sitting or lying down for administration of the AviQ autoinjector.
If you are ready to use, pull off red safety guard. To inject, place black end against outer thigh, then press firmly and hold in place for 5 seconds. 5, 4, 3, 2, 1. Injection complete. Seek emergency medical attention.
Another type of autoinjector, the generic epinephrine autoinjector, is given with the student in the same position, either sitting or lying down, the same site of administration, and will also go through clothing. But the needle doesn't retract after giving. It will stick out, so be careful. You can put the sharp end back into the hard plastic case and hand it to EMS when they arrive. Be aware that when administering, the needle should be held in place for 10 seconds. All the different types of autoinjectors also have the instructions for use written right on the autoinjector itself. They all come in a hard case as well. Stock epinephrine is located in every health office and is available during the day for use for students who don't have an autoinjector at school or accessible, but show signs and symptoms of anaphylaxis. It should be administered by a medication administration trained staff member. Note that the health office is locked at the end of the day. If the stock epinephrine is used, student health services must be notified immediately so that we can replace them for the next potential use. Stock epinephrine does not go on field trips. If during anaphylaxis symptoms reemerge and 911 has not arrived, give the second autoinjector if available in the other leg. Stay with the student until 911 does arrive. The student must be accompanied to the hospital by LCPS staff member. Asthma is a chronic respiratory disease characterized by airway inflammation and swelling, constriction, and excessive formation of mucus. It can be well controlled with only occasional mild symptoms, or it can be potentially life-threatening. Asthma can be triggered by a number of things that may need to be avoided by the student. Cigarette smoke, air pollution, air fresheners, strong perfumes, environmental causes such as cold air, mold and pollen, exercise, hormonal changes, and illness. Please avoid causing exposure to some of these items such as flowers, heavy perfumes, etc. When a student is having difficulty with their asthma, they may have some of the following signs and symptoms, such as difficulty speaking, breathing, or walking, strained neck muscles, fearful, anxious, may state that their chest feels tight. They may have persistent coughing, audible wheezes, or pale skin, blue lips, or nail beds. Please be familiar with students' asthma individual healthcare plans or action plans. If a student is having mild symptoms, they may be accompanied to the student health office as per their plan. If the student has an order to carry their inhaler, they may take their inhaler as per their plan. The student may be scheduled to take their inhaler for routinely scheduled times, such as before PE. If they're having repeated use of their inhaler in the classroom, you need to make the health office aware, as they may not be getting relief that they need. To use the inhaler, shake and prime the inhaler, have the student exhale fully, and insert the inhaler in the aero chamber or mouth. Press down on the inhaler to give one puff as the student takes a deep breath in, holds the count of 10, and then exhales. Wait at least 1 minute before repeating as per doctor order. A student having severe asthma symptoms may not be able to make it to the health office. Please contact the health office and identify the student so that we can come to them. Remain calm and stay with the student. If they carry an inhaler, assist or help give the inhaler. Continue to monitor ABCs, airway, breathing, and circulation. Give care as per the student's emergency action plan. We may need to call 911. If a student is having a seizure, contact the health office and identify the student in case the student has medication treatment in the health office. After contacting the health office, protect them from injury, lay the student on the ground on their side if able, cushion their head and maintain their airway. Do not restrain them or put anything in their mouth. Ask someone to escort other students away. Note the time, duration, and movements of the seizure if possible. If the student has a specific seizure plan in place, this will be followed, which may or may not include medication. The school nurse or resource nurse will review these plans with teachers and other staff for a student with known seizures. 911 will be called if a student has a first-time seizure, a history of seizures and no seizure action plan, a seizure and is pregnant, a seizure precipitating or resulting from a head injury, or slow recovery or a second seizure or multiple seizures, or compromised airway, breathing, or circulation. Some students may return to class or normal activities as per their seizure care plan for a student with known seizures. Familiarize yourself with their plan. Teachers are frequently the first to notice signs of diabetes in undiagnosed students. If you see frequent bathroom trips, student who is always thirsty or hungry, low energy or mood or behavior changes, please notify the health office and the parent. If a student has been diagnosed with diabetes, they can carry medication, supplies, and test their blood glucose at any time, anywhere. Students need to have fast-acting sugar with them at all times, including drills and evacuations. Low blood sugar is more urgent and needs prompt attention. The symptoms of low blood sugar are hungry, headache, sweaty, difficulty speaking or confusion, clammy skin, may feel shaky or dizzy, lightheaded, or they might be pale. Treatment for this is giving a fast-acting sugar and contacting the health office. You are encouraged to take the Diabetes Management 4-hour class. We must have a minimum of 3 staff members in the school if a student with diabetes is present. Headaches can be caused by a number of different things, such as lack of sleep, hunger or dehydration, visual eye strain or difficulty, illness or injury. Treatment for a student with a headache not caused by a migraine might be to try some water first and let them rest for 10 minutes before sending to the health office. If a student does suffer from migraines, however, these students need to be seen and treated at the first sign of headache. We will have a very different level of concern and may take emergency action if a headache is accompanied by a known head injury, changes in vision or speech, numbness, vomiting, seizure, disorientation, confusion or memory loss, a known medical condition such as a shunt, severe, persistent, or sudden onset, escalating pain levels, or drainage from their ears or nose. If a student has had a head injury or fall or injury to the neck, need to ask yourself, should I move this student or should I ask the health office staff or 911 to come to the student and evaluate them in place? If we have seen and sent a student with a minor head injury back to class with a red or yellow laminated card, be aware that this gives information about when that student should return to the health office for reevaluation. Report any loss of consciousness or changes in behavior to health office staff. We may have also sent a head injury form back with the student to take home that day to the parent. Teacher participation is critical for the return to learn process by providing valuable feedback as well as what they are seeing in the classroom. Students' progress will be monitored and academic modifications will be made as the student progresses through the stages of the return to learn protocol and can return to full academic participation. A nosebleed is usually harmless, but if it follows an accident, fall, or head injury, then it may require medical attention. Use gloves if there's a possibility of touching blood. Keep the student upright with head tilted slightly forward. Have the student pinch their nostrils just below the bony part of the nose using their thumb and forefinger. Do not release the pinch for at least 5 minutes. Have the student breathe through their mouth, and give the student tissues to hold on their nose. Ask the student to try not to sniff or blow. Send students to the health office or contact the health office if bleeding is severe, persistent, or associated with a head injury. We'll come to you. Ice packs are usually used for injuries that are no more than a day old. Please do not allow students to remove the ice pack from the bag or covering, as this increases the risk of puncture or the bag breaking and releasing harmful chemicals and potential for burns. Do not put ice directly on skin without a cloth or paper barrier. Please return reusable ice packs to the health office, as these are expensive. First aid for cuts and lacerations. For paper cuts, please allow them to wash and bandage this in the restroom. Wash it with soap and water, not hydrogen peroxide, and cover with a Band-Aid. We do not carry antibiotic cream in the health office. If there is active bleeding or an open wound, apply pressure and notify the health office. If a student loses a permanent tooth while at school, notify or send them to the health office. If they're on a field trip, you can treat in the following way. With gloves on, pick up the tooth by the crown, not the roots. If dirty, gently rinse the tooth in water. If the tooth is intact, you can reposition the tooth in the socket immediately if possible. Keep the tooth moist at all times, either in milk or mouth next to the cheek, not tap water. Seek immediate care within 30 minutes and contact the parent and school. Remember, if the tooth loss resulted from an associated head injury, they may need to remain in place. For students with a fever of over 100 degrees for greater than 20 to 30 minutes, chills and lethargy, or unable to participate in their school day, we may send them home. If their temperature is near 100 degrees and the student appears well, we will encourage water and rest and retake their temperature. If the student's temperature is not 100 degrees but they appear ill and are unable to participate in their school day, we may also contact the parent and send them home. Be aware there are some students with chronic illnesses that warrant immediate action with a fever of any kind. Students should be fever-free without the aid of medication for 24 hours prior to returning to school, but this is only a guideline. We cannot force a child to stay home. Stomach aches may be caused by a number of things, including anxiety, hunger, emotional concerns, constipation, or illness. Care in the student health office may include taking their temperature, using the bathroom, and they may be sent back to class. Vomiting does not always indicate illness or constitute exclusion. It may be caused from overeating, eating too fast, excessive physical activity, excessive coughing, food allergy, or emotional concerns. The student may go back to class if the vomiting seems isolated, unrelated to illness, and the temperature is below 100 degrees. There may be several causes of red eyes, and in the health office, we may have them rinse their eyes, wash their hands and face, use a cool compress, encourage frequent hand washing, discourage touching their eyes, and contact the parent or guardian. We may advise the parent to contact their health provider. Per the American Academy of Pediatrics, exclusion is no longer required for this condition, and antibiotics are not required to return. We might send a child home if they are so uncomfortable that they are unable to participate. Communicable illnesses. Please do not initiate letters to parents or other communications with parents. If a student expresses that they have been diagnosed with a communicable disease such as chickenpox or pertussis, etc., contact the student health office. and they will notify the Student Health Services supervisor, who will work with Loudoun County Health Department to determine the best course of action. If a letter needs to be sent home, the supervisor of Student Health Services will provide as directed by the Loudoun County Health Department. Adolescence can be a time when the symptoms of many mental illnesses first appear. Half of all people who ever develop a mental illness will have had their first episode before the age of 14. Some of the factors that may put the adolescent at risk are hormonal changes, social isolation or bullying, sexual orientation and gender identity, concerns about appearance, experimenting with alcohol and other drugs, and increased risk-taking behavior. Be aware of harm, self-injury, extreme weight loss or substance use, extreme distress, panic attacks, reactions to traumatic events, changes in behavior or appearance, and suicide threat. The school nurse or resource nurse, school administrator, counselor, psychologist, and social worker are part of a unified mental health team that serves as a school safety net for students. Immediately contact the school counselor when a student is in crisis or verbalizes risk of harming self or others, or if there's any other concern about the mental well-being of a student. If the counselor is not available, notify another member of the team. If you have any concerns that one of your students may be using drugs or alcohol, follow your principal's instructions and contact the school nurse. A field trip is defined as any time a student or group of students leave the school campus as part of an official school-sponsored activity, including another LCPS school, extended day trips, before and or after the normal school day, overnight trips, weekend trips, overseas trips, and community independence instruction. Please notify the Student Health Office and parents of students with allergies, diabetes, and other chronic health conditions as soon as they are scheduled. Please provide written details of who is attending, including staff and chaperones, grade level, departure date and time, return date and time, destination with activities and meals that may be involved during the trip, and bus lists. Students cannot be denied access to a field trip due to their medical needs, and parents are not required to attend to provide care. We may need to work with designated staff well in advance to ensure that the staff who are going are properly trained or certified, and where that care can be safely provided. We may also need to coordinate with the parent regarding care to be given, student reminders for carrying their own medication, and other details. Prior to departure, the coordinating staff member should visit the health office to review health condition lists and action plans, procedures and care that will need to be given, medication to be administered and signed out, as well as how to document medication administration. Medication, physician's orders, and individual healthcare plans are sent with the teacher along with ice packs, gloves, and Band-Aids in a field trip first aid bag, with medication forms for completion if given. Medication must remain with the teacher or staff member who signs it out of the health office. Keep medication on your person. Do not give it to a parent or chaperone unless it's the student's own parent. The parent of the student may take the medication and administer it and will need to document and sign that they administered it to the student. Also, do not leave medications on the bus or in extreme temperatures. The teacher must remain with the student whose emergency medication he or she is carrying for the entire field trip, including during transportation. The elementary student must be in a group with the trained staff member if the parent is not on the field trip. Students with diabetes and students with emergency medications must remain with a staff member who is LCPS trained staff member for the duration of the field trip and during travel time. If the field trip will depart or return during non-school hours, please make arrangements prior to your sign out of the field trip bag or meds and supplies as to where and how to keep them secure. Early communication is critical for field trip planning. We hope this has clarified and answered questions, but please contact either the health office staff at your school or Student Health Services with any additional concerns or questions. We welcome your input and thank you for supporting the health and safety of students.